Duncan, and I'm a senior consultant with the Results Leadership Group and a faculty member of the Asset-Based Community Development Institute at Northwestern University. And today's webinar is about the intersection between asset-based community development and results-based accountability to achieve greater results and impact for children, families, and communities. Before we get started, I just wanted to remind everyone that we will be making available this recording of the webinar, the PowerPoint, and a couple other documents that I will reference during the webinar. And you can receive all of that material by replying to the follow-up survey that you will receive during the webinar. Also, just to make sure everyone can hear, if somebody could kind of in the chat box let me know that you can hear us okay, or hear myself and Eileen, who's helping me on this webinar today. Also wanted to remind you, because of the large number of participants we have on the webinar, we will not be able to take people off of mute with their phones. So if you do have a question during the webinar, please feel free to type it in the chat box, either during some times where I'm going to stop specifically for questions, or if you have a question during the webinar, please feel free to enter it in the chat box as we go through. So again, just a quick second on the Results Leadership Group. We provide performance management software training and services to help governments and nonprofits and foundations track performance and achieve greater results. We have consultants that can work with organizations to help achieve greater results by using results-based accountability. Before we get started, wanted to see who is on the webinar, on the call today, and so we'd like to do two polls, and Eileen Finn will be helping me with the polls in the webinar today. So Eileen, let's go ahead and do the first poll. All right, Eileen, we can go ahead and close this poll and show people the results. Looks like it's pretty divided between heard of it, but with limited knowledge, and using RBA would like to know more, with just a few folks that have not heard of results-based accountability. So again, if you want to close that poll and move on to the second one. Okay, the second one is, how familiar are you with asset-based community development? Okay, let's go ahead and close the poll. And as you can see, and share it, so you can see that, again, about 60–70% of the folks are not that familiar with asset-based community development. So we will drill down a little deeper with asset-based community development as we move forward. So as I start, one of the things I wanted to highlight, I spent more than 40 years as a human service and professional, working primarily in United Ways for about 30 years, helping to make change in our communities. And these are some of the key assumptions that really drove my work over the years to achieve greater impact and results. First one is understand that we're dealing with complex problems. Complex problems working with people because the variables change, our communities are complex, and so we can't define or design sort of simple solutions or even complicated solutions. We really need to focus on a wide variety of strategies, because what works for one family won't work for another. What works for one individual won't work for the next 5 individuals. So we have to be flexible, and we need data and information so we can make mid-course corrections when we find something is not working. So it does take a wide variety of strategies and activities to achieve community impact. It's not just about programs, but we have to be able to change policies, institutions, and structures. And from my perspective, to achieve real impact requires the community and its residents to be involved as what we call producers and co-producers of their own and their community's well-being. And I'll be talking about that today. How do we as institutions help individuals become part of the solution that we're trying to achieve? Also, communities have an abundance of resources. We need to look at the through the abundance lens and not through a scarcity lens, and be very clear that there are resources beyond just money, which we often think is the only resource that we have. So we need to take a broader perspective and realize that our role is to identify and engage and connect all of the resources in a community. Also, organizations do not collaborate. The city doesn't collaborate with the county. The organizations don't collaborate. People do, based on common purpose, relationships, and trust. So we have to take the time that it takes to build relationships and trust as we move forward. Also, we need to conduct our work through a racial equity lens to make sure that no one is left behind and that we're clearly understanding the issues and the problems that are confronting everyone in our communities. So people, places, and results matter. People as part of the solution, not just recipients of services. The way we build stronger communities is focusing on neighborhoods, one neighborhood or community at a time to begin to do that, and we must be willing to be held accountable to achieve the results that we're trying to achieve in our communities. So one of the ways to think about this, the analogy I use, is if the helping communities, kids, families, seniors be healthy and strong and safe, if we think of that as a marathon race is very long, 26.2 miles, and or 44.4 kilometers if we're outside of the United States. And so if we're focusing on that, and the only people in the race, running the race, are the professionals, the human service professionals, the health professionals, the government and nonprofit employees, and we as the community are waiting at the finish line for them to come across the finish line and help us, or save us, if you will. We've been waiting a long time, and the professionals haven't been able to finish the race and get across the finish line because it's too long. It takes too much time. They take a wrong turn. They lose a grant. They get lost. So what we need to do is purposely turn the race of helping people in our communities into a marathon, into a relay race. And if we turn it into a relay race with teamwork, then we do have a much greater chance, if we pass the baton to people, to do those things that they can do. And in some cases, things that only they can do, we have a greater chance of getting across the finish line and helping individuals and our communities become stronger, healthier, and more self-sufficient. So I think many of you are all familiar, I think, with John and Mark's 5 conditions of collective impact. So I want to set the stage around our work using the lens of collective impact, and I think you all are familiar with the 5 conditions that they identified: common agenda, shared measurement, multiple reinforcing activities, continuous improvement, and backbone support. I wanted to highlight that these are very important, and I think it's been a great addition to our field, but they're not necessarily new. Elizabeth Shore from Harvard, in her book Common Purpose, almost 20 years ago, talked about almost exactly the same 5 conditions. And these are the 5 conditions that have driven my work over the years. That we have to be clear about the purpose of our work, the outcomes we're trying to achieve, and that again, it's about the hopes and dreams of the people that we serve. Be willing to be held accountable for achieving those purposes. Again, the accountability piece is critical. And we need to create and sustain partnerships that are necessary to achieve these purposes. So again, no one institution or organization can do it alone. It really takes the entire community working together to achieve those results. And we have to have the capacity to take community-wide responsibility to assure that the actions will lead to improvement. And that's really the backbone organization role as we move forward. So for me, I've kind of developed these 4 components of effective collective impact, and I've written a paper about these, and you can receive that paper as part of the package of material and handouts from this webinar today. But these 4 components, common purpose, again, not just improving the human service system or the service system, but really focusing on the hopes and dreams of people that we serve. Focusing on community engagement and co-production. How do we effectively engage people? as part of the solution, as part of the relay race, focusing on relationships and trust so we can build the true collaborations that are required and the way agencies and organizations can work together effectively. And then finally, results and accountability, being willing to be held accountable, as well as to have the information that we need to make the mid-course corrections. So what I'm going to talk about in the webinar today is how asset-based community development and results-based accountability can really provide frameworks to help us effectively implement our collective impact agenda. So let me start with results-based accountability. I'll go over it fairly quickly because, again, based on the poll, most of the folks on the webinar are familiar with Mark Friedman's results-based accountability and his book that he wrote about 10 years ago. Trying hard is not good enough. He's just published and released a new book last month called Turning Curves, an accountability companion reader that I truly recommend to everyone. But RBA is a disciplined way of thinking, focusing on ends to means to help us make greater decisions by focusing on common language, common sense, and common ground. And the two key principles for achieving measurable impact using RBA are that, one, we need to start with the ends and work backwards to means, so be very clear about what we're trying to achieve in our community, not just, again, deliver services, but we're trying to improve lives. And data-driven, transparent decision-making. So we have to be very clear that we need information and data so we can see what we're doing, so we can make mid-course corrections to identify when we need to change because something is not working. So RBA in a nutshell, as Mark talks about it, 237. There are two kinds of accountability: population or community level, quality of life accountability with the results and indicators, and performance or program level, so that we're dividing that into both population level and performance level or program level outcomes and accountability. And there are three kinds of performance measures which measure how much did we do, how well did we do it, and is anyone better off? And everything we do can be measured in one of those buckets, if you will. And then finally, 7 questions that can help us get from ends to means very quickly, literally in less than an hour. You can come up with a plan to begin to do something in your local community using the 7 questions and RBA. So one of the ways to think about it is results-based accountability, again, is made up of 2 parts. Population accountability, about the well-being of whole populations, whether that's in a neighborhood, a community, a city, a county, a state, a nation. And performance accountability, which is about the well-being of individual clients of programs, services that we may be delivering. But the key to this is that population level results, changing to improve a community. So for example, people in a county go a whole day without, how many people in a county go a whole day without eating a meal? The whole community is accountable for improving community level results. It's not the responsibility of one agency or one program or the city or the county. It takes the whole community. But for program level measures, that is where we're measuring how many Meals on Wheels people were fed during a month or during a week. So program managers and agency directors and city and county staff, government staff, are potentially accountable for their own programs and strategies and activities that they implement. But it takes a wide range of activities and the entire community to achieve population level results. So one of the ways to think about it, at the population accountability level, it's about results, indicators, baselines, and turn the curve thinking. So results are a condition of well-being for a given population, such as a safe community, all youth succeed in school, and results should be written in a common language the community will understand. So we really want to have a result written in a way that it passes the town hall test, that people, or the town square, people understand what we're talking about as we focus on a result. And an indicator is a measure that helps quantify the achievement of that result. That's when we begin to look at data at the community level. So for example, if our result is all children in our community succeed in school, indicators of that could be high school graduation rate, percent of students performing at grade level, or the overall attendance rate for a community or a school district. And one of the things that I think is important, that sources of indicator data. Indicator data is collected at the community level, whether that's through the census, the State Department of Education, a state health department, a county health department, but it's collected from community level data. Indicators are not collected from agency program client data, so we don't just roll up client data to create indicator data. Indicator we want to collect because, again, we're measuring the impact of over an entire community, not just the client served by an individual organization or even a group of organizations. The other piece is baselines, and baselines have two parts. Once you identify that indicator data, whether that's high school graduation rate, high school dropout rate, whatever that may be, it has a history, so you can look at what's happened over the last 5 years, the last 5 years, the last 3 years, and based on that you can look at a forecast of identifying that if we do nothing, we can assume that the indicator will continue to go up or down as it has, maybe with a little bit of variation. So our question becomes, is that okay? So if we're looking at the dropout rate, we, I think, very clearly would identify that that's not okay to see the graduation or the dropout rate to continue to increase. So one of the things that then becomes clear is our role is to turn the curve. What do we need to do to change that trend line over time so that we can, in fact, reduce the dropout rate in this community? And what becomes very clear, which is why I like this visual of turning the curve, is it becomes very clear that it takes a wide variety of strategies to turn the curve. Beyond the delivery of services, it requires community action, media, public policy, a whole host of activities if we're going to turn the curve. Another way of thinking about it is it takes the entire community and many, many people, many, many programs and institutions and individuals all pulling on that curve to change the curve and improve lives in our community in relation to that indicator. So here's just a quick example. I think you're probably familiar with it. MAD, when MAD was introduced and they introduced their efforts, and again, it wasn't just a program. MAD is not a program, it's an initiative that engages communities in public policy work and activities and a whole host of activities, and over time they've been able to help reduce traffic traffic accidents based on alcohol use in our communities. Another example is Tillamook County in Washington was able to, in Oregon, was able to reduce teen pregnancy rates by focusing on what it takes as a community to reduce the teen pregnancy rate in their community. In addition, in Vermont, they were able to begin to reduce the obesity rate for adults 20 and over by focusing on that and identifying what it takes in a community, in a state, to reduce the obesity rate. So here is another example of working to turn the curve in our communities by focusing on what are the factors that'll impact and are impacting on the curve, and what do we need to do to change that curve and reduce it in our community, or increase it if it's going the good way. What do we need to do to increase it and accelerate the change to improve it? So here are the turn the curve thinking at the population level result. So these are the 7 questions that an organization, or a community can use to come together around a collective impact table to talk about what do we need to do to turn the curve. It starts with, again, the end result we want. What are the quality of life conditions we want for the children, adults, and families in our community? What would these conditions look like if we could see them? So this is where, again, we develop a common sense, common language understanding of what we're trying to achieve: more kids safe, more families safe, more kids healthy, more families healthy, whatever that may be. And then to make sure that we're very clear about what is that end that we're trying to achieve, take some time thinking about what would these conditions look like if we could see them. What would our community look like 5, 10 years from now if we're successful in achieving that result? So, and again, you could almost think of this, the first question is the mission, the second question is the vision. What is that vision we're trying to achieve for our community? And then the third question is, how can we measure these conditions? That's when we identify the indicators, the headline indicators that we want to choose, maybe 3 to 4, 3 to 5 indicators that we can use to really measure whether we are, in fact, in a community achieving that result that we are focused on in our community. The fourth one is how are we doing on the most important of these measures. That's where we actually graph the indicators. So we look at the trend lines and the forecasts so we can identify, are we doing well or not? Is it okay or not? And if it's not okay, we can do something, or we can talk about what we call our turn the curve thinking, where we actually talk about the story behind the curve. Why is the dropout rate increasing? Why is obesity increasing in our community? What are all the reasons that that could be occurring? And we want to ask ourselves 5 or more times, so we're really drilling down to all the potential reasons why an indicator may be going the way it is, so that we can begin to develop some effective strategies. The fifth question is, who are our partners that have a role to play in doing better? It's important we ask this question before we jump into strategies, so that we make sure that we are in fact engaging the entire community and many, many partners in this work, so we can look for the role that community has and other partners have in doing this work. So once we identify some of the key partners, and I really suggest that we're always asking this question. Every time a collective impact group comes together, we're asking the question, who else needs to be around the table? Who are we missing? And so, but the sixth question is now, what works to do better, including no-cost and low-cost ideas. And the no-cost, low-cost ideas is where ABCD comes in, asset-based community development, and I'll talk about that in a few minutes. But we really want to brainstorm a wide variety of activities that we could be doing and implementing in our community to turn the curve and improve the results in our community. Once we've brainstormed a large number of activities, we can't start all of those tomorrow or in the next day. So what do we propose to do? What is our action plan over the next month, the next 6 months, the next year? And as we move forward, using these 7 questions to always add new actions and activities to our strategies, because again, no one program, no one solution is going to be effective to turn a curve. It takes a whole host of activities, and through these 7 questions we can identify the means or the ends that we're trying to achieve, the partners that we need to help achieve it, and our activities to help us achieve the result. So let me stop there and see if there are any questions or thoughts about results-based accountability. So again, if you have a question, please feel free to type that in the chat box. I know I did that rather quickly because of the time that we have for the webinar today, but I do want to, if there aren't any questions, and again, if you get any, please feel free to type them in the chat box as we go forward. So let me now ask a third poll question before we start talking about asset-based community development. So Eileen, if we can do the third poll about, are you currently involved in a collective impact initiative? All right, if you want to go ahead and show the results, it looks like that almost 50% are involved in one, and others, about 50%, aren't. So that's a good sense that we really do have a wide range of folks involved in collective impact efforts. And then Eileen, let's ask the last poll now. Do you currently include place-based strategies as part of your local community initiatives? Again, asset-based community development, a key component of that is place-based work. So I just wanted to see how many folks are engaged in place-based work. All right, looks like you can go ahead and show that result, and a large percentage of you, 65%, are involved in a place-based strategy already. So that's very exciting as we move forward. So now I'm going to talk about asset-based community development. Again, a number of you mentioned that you were not very familiar with ABCD, as we call it. ABCD was developed by those two gentlemen, John McKnight on the right and Jody Kretzmann, two professors at Northwestern University. And they wrote a book in the early 80s called Building Communities from the Inside Out, which was based on going across North America, looking at about 300 neighborhoods and communities to identify what are the ingredients of healthier, strong neighborhoods and communities and what seemed to be the difference. And what they identified was it was focusing on the assets and the abilities and the skills that people had was a key ingredient to successful, healthy, strong neighborhoods and communities. So they developed asset-based community development, because their analogy is that it's the capacity of local people and their associations that build powerful communities. What can we do with what we already have? So the questions change. With ABCD, it starts with different questions. Rather than what do you need as our initial question, the question becomes what can you contribute? And in a community or neighborhood, not what do you need, but what can we do with what we already have to get what we need? So I've developed some key principles that I'm going to use to talk about ABCD today. The first one is the characteristics: asset-based, locally focused, and relationship-driven. Again, it starts with the assumption that everyone in a neighborhood, everyone in a community has something to contribute. Everyone has something we call gifts. And so our job becomes unlocking those gifts by engaging people in the life of the neighborhood or the life of their community. And John McKnight and Jody Kretzmann, when they wrote their book, they identified 6 key assets that are available and active in healthy communities. And so those 6 assets, the first one starts with people sharing their gifts. People are involved. The adults know the names of the kids and are working with kids in the neighborhood. The neighborhood is caring for the seniors living alone in their neighborhood. People are connected and sharing their gifts. Just a quick example of that, I just moved to a new neighborhood. And as I moved into the neighborhood, Pat, the neighbor next door, came over and looked as we were unloading our stuff and said, looks like you don't have any ladders. That's great, because in the neighborhood, I provide the ladders for our neighborhood. They're over on the side of my house, so if you need a ladder as you're moving in, please feel free to come on over and borrow the ladder. You don't have to ask, just come and get the ladder. So that's an example of people sharing their gifts in a neighborhood to build a stronger neighborhood. The second ingredient is the associations in a neighborhood. The associations are where people come together voluntarily because of their passion, and associations are very powerful. The biggest example, the largest example of an association is where people go to pray. Again, people aren't paid to go to church or synagogue or temple. They go because of a passion. But just think about the power in a community if we have all of those folks that are involved in a church or involved in their faith being part of the community or a neighborhood. But there's also book clubs and reading clubs and service clubs and athletic clubs. In this one community, there was the men's softball league, and they played softball every Wednesday. The neighborhood knew that some of the kids in the neighborhood were sort of beginning to do some pre-gang activities, so they went to the men's softball league and said, one Wednesday a month, would you be willing to work with the kids in the neighborhood rather than playing softball? And they said, absolutely, we'd be glad to do that. Why weren't they already doing it? Nobody asked. So that is a term and a word that I suggest everybody write down, because in today's society, unfortunately, we have kind of become a little step back. We're not as engaged as we once were in the life of the neighborhood. So one of the things we suggest is we do have to purposely ask people to become involved and share their gifts. But that's the association life, and in a healthy neighborhood, the associations are part of the life of the neighborhood. The next ingredient is the institutions in the neighborhood, the business, government, and nonprofits, but they're playing a little different role. They're doing something we call, and I'll talk about it later, leading by stepping back to create space for people to do those things that they can do in a community. So businesses are hiring people from the neighborhood. The corner grocery store is offering more healthy produce. So in a healthy neighborhood, the business is part of the life of the neighborhood and giving back. Also, governments and nonprofits are part of the neighborhood. They're engaged in the neighborhood. They're involved. They're providing support for the neighborhood beyond just the services that they deliver. The next ingredient is the environment, whether that's a vacant lot for a community garden. So a neighborhood that's identified that they have a problem of hunger in a neighborhood, they could use a vacant lot in their environment because they live somewhere where they could grow produce year-round. They can use the environment strategically to to develop a community garden to help feed people and address hunger in their neighborhood. They don't have to wait for people from the outside to address the issues. And then finally, or not finally, the fifth ingredient is the time and money exchange, using the economy strategically, organizing the buying power in a neighborhood to make sure that the corner grocery store offers better produce, creating the people sharing their time, sharing their gifts, using something like time banking as a way to bring time and money exchange and broaden the economy in a neighborhood. And then finally, culture and stories, because that's what brings people together and creates relationships, are the culture and stories. So those are the 6 ingredients that were identified by John and Jody in a healthy neighborhood. So the work becomes of really trying to see how we can make sure that we're using all of these assets, individual talents and skills, the local associations, the institutions, the physical environment, the economic strengths, and the culture and stories. And that's because effective communities look inside first to solve problems. They don't wait for people from the outside to solve them for them. Relationships are seen as power. That's how we connect people, is through relationships. They have a good sense of their assets and capacities, not just their needs. Leaders are connectors, not dictators. Leaders open doors and connect people with the same passion to act collectively. And later I'll show you through asset mapping how leaders can begin to do that. Citizens are involved. We call citizens of a neighborhood people that are engaged and sharing their resources. They are citizens of the neighborhood, and we need everyone to be a citizen of the neighborhood and their community, because engaged people take responsibility for their own and their community's well-being. Locally focused, what can we do with what we already have in our neighborhood to improve our neighborhood? Why place-based strategies? Kind of a couple reasons for that. First of all, it's where families and their children live. So if we're going to engage people to work on things, we ought to start where they live, where they are. And it's also where the action is, both the good and the bad. And the more we can increase the good action, the connections, the less room there is for bad results in a community. To help kids succeed, they do better in strong families, and families do better in supportive neighborhoods. This was the kind of the guiding principle of the Annie Casey Foundation's Making Connections initiative. They realized that just delivering and improving programs and services was not enough. They also needed to engage communities and neighborhoods as part of the solution. Also, place-based initiatives help simplify engagement. If I want to get involved in my neighborhood, or if I want to get involved with the solution, and I just have to walk out my door and go a couple doors down, it's a lot easier to become engaged than if I had to get in my car and drive for an hour from one side of the community to another. So if we're really looking to increase engagement and get everyone involved, it's much easier if we can remove the barriers of transportation and people can just become involved where they live and where they're engaged. Also, place-based strategies are the ways to help increase what we call social capital and collective efficacy. And both of those have scientific kind of results, proof that they, in fact, do make a difference when we focus on social capital and collective efficacy. Social capital refers to the connections among individuals. The more positive relationships that people have in their lives, the more apt they are to be healthy, employed, and connected. So social capital is very important. And again, we're not as connected as we once were at the neighborhood level, so we want to work on increasing the social capital in a neighborhood. Collective efficacy is the ability of people to come together in a neighborhood and get things done by just focusing on the gifts they already have. And the more we can create collective efficacy in a neighborhood, the more we increase hope and connections, and it also has impact on physical and mental health, violence, and other key issues. So focusing on social capital and collective impact can have a huge impact on a community as we move forward. The other way to think about it is that we have the I call these the circles of care and responsibility. We have the individual in the middle. They're surrounded by their family. They're then surrounded by their friends and neighbors. They're then surrounded by their association life. I think everybody belongs to probably one or more associations, and the largest one is, for example, where people go to pray, the faith-based connections. Then I added a new one recently, which is social media and communities of interest, because that is having an impact on whether people know their neighbors or not. It also can be an opportunity for support using things, social media like Nextdoor, which is a new web-based system like Facebook, but for neighborhoods. And then we have the nonprofit sector, the helping professionals, and government. And what's happened over the years is that the upper top rings, government and nonprofits, have been jumping over all of those other rings to rescue the person in the middle, if you will, the client or the patient or the student. And the more we jump over those other rings, the more we weaken them. And the problem is those are the rings, family, neighbors, friends, association life, are the rings that are there 24/7, that are there in a community or a neighborhood. So what we want to do is make sure as government and nonprofits that all of our strategies work to include and strengthen all of those rings in an effective way and not jump over those rings, because again, the more we jump over them, the more we weaken them, the more we engage those rings, the stronger we can build a community to help provide that support that we may have in a neighborhood or community. So for example, if we're helping, I was working in Indianapolis and we had an initiative to help women that were coming back from being incarcerated back into the community. And our solution around that was to identify individuals in the community, first family and friends, but also neighbors. Identify who in the neighborhood has already made that successful transition from incarceration back into their community, back into their neighborhood, and how could they provide peer support for women coming back into the neighborhood to help them be more effective. So we didn't rely on just programs and services, but we relied on neighbors and people that had the skill and ability to help make those transitions. Relationships. Again, that's how we unlock gifts, by having relationships so that we can engage people in effective ways. So it's very important for people to know their neighbors again as we begin to do this. So what are the processes to make sure that people know their neighbors? Have a process to do that. There's a great book called The Art of Neighboring, written by two pastors in Colorado, that identified a way for people to know their neighbors and effectively engage with their neighbors in this work. And so we want to do that. So just a quick story. I was talking about the importance of people knowing their neighbors. And when I was doing a workshop in Toronto, this woman mentioned that the importance of knowing your neighbors. This gentleman decided to do some trimming of his trees in his neighborhood. He put the ladder out, went up the ladder. A gust of wind came, knocked him off the ladder, and he fell and broke his back. So he's laying on his back in his yard, and he realized, where do I go? My wife's not home. I'm all alone. And because he knew his neighbors, he knew that the people 2 doors down across the street both worked from home. So he was able to crawl across the street, get to their front porch, ring their doorbell. They came out, they knew him, they were able to call his wife and get the support he needed, so he's fine now. But if he didn't know his neighbors, if he didn't know who was home, he may not have been able to get the support that he needed. So in a community, it's really important that everyone knows their neighbors in today's world and are connected. The second principle, is people-powered change. These 3 very important questions, being very clear from an institutional perspective about what can residents do by themselves for themselves around a particular issue, what can residents do with a little help from institutions, and what do residents need done that they can't do. Because there are things that people can do by themselves for themselves. There are things they can do with a little bit of help. And if we focus on that and help create that in a community, we have a much greater chance of success. Let me just give you 3 quick examples. Creating health, creating safety and security, and raising powerful, connected children. If we think about, according to the World Health Organization, the social determinants of health, once we kind of counter for heredity, and there are kind of 5 key ingredients of whether somebody is healthy or not. The first one is personal behavior, whether people exercise, whether they eat right, whether they take care of themselves. That is the largest, it has the largest impact on whether somebody is healthy or not. The second one is social relationships. People that are isolated tend to have more health problems than people that are connected. We all know the story of an elderly couple that lives a great life, and then one of the couple passes away, and if the other stays isolated and is not connected, they very quickly pass away as well. So what do we need to do to make sure that people are connected? In Tucson, as a way of addressing this, when I was in Tucson, we helped start something called the Neighbors Care Alliance, which, because a lot of seniors moved to Tucson as a Sun Belt community to retire, and one passes away, their support system may be back in Chicago, Illinois, or Peoria. So we started a formal process to make sure that in every neighborhood, in every community, there was a formal process to adopt the seniors living alone and the people in the neighborhood that had a passion to help care for seniors living alone, so they could help them stay healthy and stay in their own homes longer and build on social relationships. The third is physical environment. If you're homeless, or if you live close to toxic waste, or you have a water problem that we're hearing about now, physical environment is a key ingredient of health. The fourth one is economic status. Unfortunately, the less money you have, the more you are at risk for some health issues, primarily because you can't exercise all of the appropriate kind of personal choices to be healthy. And the least important is access to health care. That's very important. If somebody breaks their leg or they have a disease, we absolutely want to make sure they have access to health care. But it's not about health. That's about sick care once they're health. To create health, we need to make sure that people exercise those things that people can do and only people can do. The county health ranking system talks about exactly the same thing. Clinical care is only rated as 20% of whether a county is rated as being healthy or not. The social factors and the environmental factors are much more important than clinical care. Also, last month, there was just a study released from the University of North Carolina at Chapel Hill, which is the first to identify a strong link between social relationships and health. So there is a direct correlation between social connection, social capital, and health conditions, and actually how long somebody is going to live, life expectancy. So health makes a huge impact. The second one is crime and safety. I think we all know that the police basically come too late, so community, block watches, people being connected have a huge impact on whether somebody is safe or a community is safe. This woman came home one day in Phoenix. She walked into her house, and everything was gone from her house, including her dog. She called the police. They came too late. They interviewed her neighbor next door, and he highlighted, and they asked him, "Did you see anything suspicious?" And he said, "No, I didn't see anything suspicious. All I saw was this white moving van come up to her house, load up all her stuff, and because I never met her, because I didn't know her, I assumed she was moving." So if they would have known each other, if he would have had a relationship with her, chances are he would have known that she wasn't moving, and he could have done something before it's too late. So block watch programs, being connected with your neighbors, has an impact. Finally, children's time during the school year. If we're going to build powerful, connected children, we have to be clear it's not just the role of school. During the school year, kids are in the school 15% of the year. They're in their home, in their neighborhood, in their community 85% of the time. So the more connections we can build for kids and connect the community and the neighborhood as part of the solution to helping build strong, connected kids, the more successful we're going to be. So healthy communities require what we call both care and service. Care is what people provide themselves, and service is what agencies and programs provide, and we need them both to provide the relay race to be successful in creating strong and healthy communities. So let me stop there and see if there are any questions or comments that anyone has on the webinar. Again, this is your time, so if you have any questions, please feel free to type them in the chat box. Again, I'm sorry, because of the number of participants we have on the webinar, we can't unmute phones. I do want to remind everyone that yes, go ahead.
We have some questions.
Great.
Okay, we have several.
Oh, good.
What are common contexts to work through? Oh, this is going back to the 7 questions. I'm sorry.
Okay. It's okay.
Okay. What are the common contexts to work through those 7 questions?
Okay, the context, again, those questions can be used at a collective impact table or a committee that's meeting in a community. So the context is, who are people bringing together, people that want to truly make a difference in their community at the population level result, not just working to improve an individual program or service. And I'm going to talk about that a little later. How do we collect the information and the 7 questions to address individual programs or services? But at the population level result, the 7 questions, the context is a group of people that want to make a difference in their community to come together. They can begin to use those 7 questions to begin that journey and that process.
Okay. The next question is, how do you accommodate externalities that influence the ability of an organization to reach its seemingly unrelated goals? Example of that is Silicon Valley rents hamper health organizations in schools.
Okay, what was the last part of that question? I didn't understand.
There was an example from Silicon Valley that it rents hamper health organizations and schools.
Okay. Okay, if I understand the question, in fact, we're going to address that a little later in the webinar, but the key is that to change a result or improve lives in a community, it takes a whole host of activities. So our goal at the population level result really is to begin to do more and more activities that increase the chances that we can, in fact, turn the curve. And I will talk about that a little later, about the difference between causality and contributory relationships to do that. So if you kind of hold that question a little bit, I think we'll address it a little more in a few minutes.
Okay. The next one is, can you please explain a place-based strategy? What a place-based strategy is?
Yes, a place-based strategy is when we include in our planning the actual location of a community, whether that's a neighborhood or a community, but we define the geographic boundaries of, again, a neighborhood or a community, and our strategies are designed to improve not only, not view the people in that community as clients to provide services to, but also view the community or that place-based as a place where we're working to increase the supports and the activities in that community. So we're taking, again, a place-based strategy looks at all the resources, all the assets that are available within that place-based location, and our job becomes to try to engage all of those resources, connecting neighbors, looking at, again, those 6 assets that I talked about earlier. So a place-based strategy includes the place as one of the tools that we use to improve lives in a community.
Okay. What are some strategies for getting schools more involved with RBA and turning the curve methods?
That's a good question. And I think to begin an RBA sort of strategy, it takes, first of all, some champions at a school that are dedicated to improving the school and that want to use this strategy of RBA. And again, there are 2 components of it, being very clear about the difference between population level results and program level results. And then as we begin to do that, developing strategies at a community level as well as within the school. And one of the ways to start with a school is to start with the performance measures for an individual school. And I'm going to talk about that in a few minutes. And when I do that, I think it'll become a little clearer about how do we engage not only a school, but we're working with governmental jurisdictions, cities, counties, states, agencies. There's a way to begin to do this by focusing on the principles and the activities of results-based accountability at both the population level result and at the individual program or service level.
Okay.
Okay?
Yeah, well, there's a lot, so you tell me how many you want to go through.
Okay, no problem.
how about can you comment, what is the time frame when working with the community using ABCD principles to get to the results portion of our work?
That's again a great question. As I highlighted earlier, this work does take time. As I like to highlight, we didn't get here in 1 year. We're not going to fix it in 1 year. So you do have to have a longer time horizon. But what you can begin to see in using ABCD is literally within months, you can begin to see people connecting that were not connected before. And again, I'm going to talk about it a little while when I talk about the asset mapping process. But with the asset mapping process, literally within a month or two, you can begin to see the beginning small starts of this, of people knowing each other that didn't know each other, people coming together to do things, but being very clear that this isn't another quick fix solution. This is a long-term solution. The other way I think about it is it is a meandering river or a stream that sometimes is going to run faster than other times as we begin to do this work.
Okay.
So Eileen, let's take one more question right now, and then because some of the questions really relate to some things that I'm going to talk about in a few minutes, and then we can come back and make sure that we answer the questions that folks have proposed.
Okay. Well, the last one I'll say is they want to know if the PowerPoint will be available.
Absolutely. Again, you should receive an email survey during the webinar or right after it, and when you respond to that survey, we will send you links for the webinar, the PowerPoint, and a number of the materials and toolkits that I'm going to talk about during the PowerPoint or during the webinar. So let's jump back in again. We will come back to your questions. I'm sorry we missed some of those a little bit earlier. One of the things I want to talk about now is the role of residents. How do we engage people in this work? And I think we need to be clear that people have 3 roles. At times, people do need to be a client, a patient, a student, a recipient of service. But then they are dependent on a professional, and the professional knows what they need. So again, if I break my leg, the doctor knows how to fix my leg. He or she doesn't need to ask me what I need or how I want it delivered. So there are times when people need to be a recipient of service, but that's not the solution to everything. The second role is that of an advisor for institutional action. In that instance, we ask people, what do you need and how would you like it delivered? But it's still about institutions and programs in charge and a dependent relationship. It's better quality service, if you will, because we have engaged people to ask them what do they need and how would they like it delivered. But there is a third role, and that third role is a co-producer of their own and their community's well-being. In that instance, we ask a new question. Not just what you need, but the first question we ask is what can you contribute? And then our role becomes to help remove barriers so people can share their gifts and become involved as producers and co-producers of their own and their community's well-being. Just a quick story going back to the Neighbors Care Alliance in Tucson. Doing that effectively, one of the things we would do if we identify Mrs. Smith and she's living alone, she's a senior living alone, when we go and knock on her door and say, Mrs. Smith, we understand you're living alone, how could we help you and provide some of your needs? We don't do that. What we do is when we knock on Mrs. Smith's door, the first question we ask her is, Mrs. Smith, we notice you're living alone, so you probably have some time on your hand. So what could you do to help other seniors that are living alone live in their own homes longer and be healthy? So we're engaging her as part of the solution by sharing her gifts. So she may say, well, I can't get out of the house very well, but I have a telephone, so I could call other seniors every day to make sure they're okay. So that's an example of how we engage people by starting not with what do they need, but what can they contribute? And you can see the switch there. And again, we do get to identify what she needs as well, but we don't start there. We start with what could she contribute. So, and when we begin to remove barriers, people can become co-producers of their own and their community's well-being. And the whole co-production movement, which to a large start has started in Wales, has been really an exciting opportunity to begin to connect with people as co-equals to help provide service and support, because we often confuse a lack of opportunity with a lack of ability in doing this work. So in co-production, We value all participants. We view them as equals with us as professionals. It builds on their strengths and their assets. We develop peer support networks, people working together to, based on their gifts and abilities, help each other. It's about mutuality and reciprocity. So give and get, working together. And it's facilitation of working together to achieve results, not just the delivery of service and the recipient of service. So the power of co-production is giving everyone a role to play to build strong, healthy communities. So here's an example of that in Falmouth, Wales. They've been working on this co-production initiative since the late 90s, and they did a study of that. And what they found out over a number of years, over 3 years, that by focusing on co-production, they were able to reduce postnatal depression by 70%, childhood asthma by 50%, teenage pregnancy down to 0 in the community, child protection rates down by 42%, crime rate fell by 50%, and employment rose by 71%. And this all can be attributed to focusing on a co-production strategy rather than a service model strategy in doing their work. Again, the essence, the principles of asset-based community development. The fourth principle is asset mapping, having a formal process to identify and discover everyone's gifts and passions, asking them to share their gifts, and connecting people with the same passion to act collectively. And I'm going to just go over this briefly in the time we have, but you can receive and download my asset mapping toolkit, which gives people a sense of how to go through this process. But before we do that, I want to be clear that engaging the community is not an opinion poll about what we think people. We're not trying to just inviting people to a meeting to tell us what they think. It's not organizing the community to care about our agenda. It's identifying what individuals already care about and their gifts and mobilizing their action. Because we've often said, well, people don't get involved. They don't do it. And that's often because we don't focus on the gifts of their heart, what their passion is, because people's passion is their motivation to act. We often recruit people to do our to-do list. So we're an agency, we've identified 5 things we need people to do, and we recruit people to do them, to volunteer. And we have to spend all our time trying to figure out how to get people motivated to show up, rather than taking the time to find out what people care about, what their passions are, and then asking them to get involved and getting engaged. And then all we have to do is get out of the way. So a quick example, next Saturday we're going to do a neighborhood cleanup, and we invite 100 people to the neighborhood cleanup. When I do workshops and I ask people this and I say, so how many people of the 100 showed up at the workshop? I typically get an answer of 10 people show up for the workshop. So out of 100, 10 people show up, and one of those 10 will always say, those other 100 people or those other 90 people, they don't care. That's not true. They just don't care about neighborhood cleanups. So if we had taken the time first to find out what people cared about, we found some cared about kids, some cared about seniors, some cared about crime and safety, some cared about hunger, and some cared about dogs. And we say, okay, next Saturday we're doing the cleanup, plus we're going to work with kids, we're going to start the block watch, we're going to start the Neighbors Care Alliance, and we're going to build the dog park. I can guarantee it that more and more people would show up to on Saturday, because we focused on the gifts of the passion that people have as we begin to do this work. So here are the steps of asset mapping. And be clear, asset mapping is not just another database. It's not just, it actually is a strategy to identify assets that are available and connect people to begin to work together. And asset mapping needs to be and must be done by the residents that call their neighborhood home. So it's done by neighborhood residents themselves, not by outside folks that do not live in the neighborhood, not as a class project from the university, but it needs to be done by people themselves. And so the process stops with forming a resident leadership team, a mapping team, finding 5, 6, 7, 8 people in the neighborhood that want to go through this process. And then you ask them, what's their geographic area for action? What is the place-based neighborhood they want to work in? This is the area where they want to be responsible for. Ask them. They get to select it. It's not selected by the city or county. It's selected by the residents themselves. And then they need to create a survey so that they could have conversations with people. So they need to identify a survey that asks what are the gifts people have, what are the things they'd be willing to teach other people about, and what are their passions, what associations do they belong to, whatever questionnaires we want to talk about. And then to do the questionnaires, what we need to do is conduct in-person conversations with neighborhood residents to identify their gifts and passions. We don't put it on the internet. We don't put the survey at the back of the church or in a community center. It's about one-on-one porch time conversations, and so that people can identify their gifts and abilities, because they're going to go back to them and ask them to come together with others with the same passion. So we want to make sure that we have a relationship, and a strong relationship with them. So one of the things I suggest is never interview someone you don't know when you start this process, because if I knock on your door and I've never met you, and I knock on your door and say, "Hi, I'm from the neighborhood, what are your gifts?" that conversation's not going to go very far. So I suggest the sort of what I call the snowball interview technique of have the resident leadership team interview each other, and then they each go and interview 5 people they already know in the neighborhood, and then ask those people that they've just talked to go interview 5 or 10 people, or however many they want, people that they know in the neighborhood. And so by doing that very quickly, you can get 50, 60, 70, 80 questionnaires completed, and nobody had to interview anybody they didn't know, and it's a starting point for this effort. The 5th step is to create an asset map. Literally get a piece of paper, draw the streets. Maybe you could work with your city or county or governmental entity to get a nice big map. They have those nice big printers that can print big maps with addresses. So you can develop that asset map, put it on the wall, and use the strategy of colored sticky dots to create your asset map, because what we want to do is map people's passions, because that's how we're going to connect them. So here's a sample from an asset map we did in South Phoenix, where we've got the agencies, the organizations, the school, the churches, again, all of those assets, but most importantly, we have the map of people and where they live and their passions. So once we do that, then we can begin to connect people with the same passion to act collectively. So these 3 people care about kids, so let's connect them and introduce them if they don't know each other. We're now building social capital in the neighborhood, and then we can ask them to connect based on their passion and their gifts, and just do something, do anything to help kids in the neighborhood. We don't tell them what to do, just say, talk about the gifts, the skills, the abilities you have. So they begin to develop the book drive, they start reading to kids, whatever that may be. These folks cared about seniors. They could start to do something to help seniors in the community. Then they can reach out to a store to do something there. They could reach out to the school to work with kids. So they can grow the circles and the connections in a neighborhood just by beginning to identify, ask, and connect. Now also we can more purposely say, does anybody know anybody down on Donor Street, because we don't know anybody down there. So you can begin to grow the connections also when you start an activity. So for example, in this one neighborhood in San Antonio we worked with, the first activity a group of people wanted to do was organize a neighborhood dance. So they organized a neighborhood dance. 61 people came to that neighborhood dance. Now they could begin to build relationships and connections. And when people come to the dance, they've come out of their door, so we're not knocking on their door. So while they're at the dance, you can begin to have a conversation about what are they interested in, what are their passions, what are their gifts, so we can begin to add more dots on the map. And so the final step of asset mapping is to recognize and celebrate your successes. So when you start things, make it fun and exciting and celebrate, because that's what brings people together. So we want to move from a block asset map to block parties and block connections, of growing the connections of people, associations, and organizations. So let me stop there and see if there are any other questions about asset-based community development.
Okay, let's see. Gotten a couple more. At what point when using ABCD principles when working in a community do we acknowledge that the people of the community are the experts?
You would acknowledge that at every point along the process. So again, when we're having a conversation with them, whether we're doing the asset mapping or just talking to them on the street. We want to treat them as being very clear that they are experts in their own life, experts in the lives of their community and their neighborhood and their family, and we would like to work with them to help them use their own expertise to be more successful in their creating their own well-being as well as their communities. So I would say we start that from ground zero, which is why I highlighted that in ABCD, the first question we ask is never what do you need, but always what can you contribute.
How can a volunteer organization, for example, VISTA, or Volunteers in Service to America, perform asset mapping duties if they are new to a community?
What I would suggest is that they would work in the community to help to identify the resident leadership team that's going to do that work. So they certainly could support the residents in doing the asset mapping process, but their first job is to build relationships in the neighborhood so they could potentially help identify that resident leadership team, those group of mappers that want to get together. And actually in a neighborhood, depending on the size of the neighborhood, you really could have more than one group of mappers in a neighborhood that are working together to try to connect people in the neighborhood, and the VISTA volunteers or people from institutions or organizations can help by helping to identify the resident leadership teams.
Are there optimum sizes for place-based strategies?
I think as a starting point, something that is walkable or maybe a little bit bikeable, but really asking people what is the area you want to be responsible for, and we want it large enough that there are enough assets and resources to begin to do the process. So maybe a little bigger than a cul-de-sac or one street, but small enough that people can get their arms around it and really understand it and connect with it. And you can always grow it over time. So I really suggest kind of start small, maybe 4, 5, 6, 7, 8 streets, and then as you begin to develop your capacity, then you can always expand it to a larger area. But if you start too small, so it may become too unwieldy and it won't lead to as soon a success as you want.
And can a social organization like a church be considered a community or a place in these strategies if its members are from many different neighborhoods?
Again, the churches are associations, and people can come together as part of an association and learn some skills. So they're not necessarily a place. I kind of categorize them as an association, but a church is located in a neighborhood, so their association can be part of that neighborhood where they live. Or where they're located as well, because one of the dilemmas we have, most people now have to get in cars or take transport to a church, to the church that they attend or the faith-based organization that they attend. And so in some cases, the location of a faith-based organization is no longer connected to the neighborhood where it's located. And it's amazing what can happen when a church can become connected to the neighborhood where they're located.
Does your toolkit have a sample timeline or a step-by-step plan that a collective impact project might benefit from?
Yes, the toolkit has a step-by-step plan that you can use to implement asset mapping as part of your collective impact strategy. So let me, at this point, move forward and just kind of highlight a few things around now I'm going to talk about tools for agencies, just some things that organizations and collective impact initiatives can use to be effective in this work. And as I mentioned earlier, the concept we talk about is institutions should lead by stepping back to create space for citizens and community action. And Rich Harwood has a great quote about that, and make sure that we're avoiding that pull inward to focus more on our institution rather than the community itself in the work we do. And so leading by stepping back, we're recognizing and supporting the 3 powers of citizenship or residence in a community: the power to decide there is a problem, the power to decide the solution to the problem, and the power to act on the solution. In a neighborhood or community, people have all 3 of these powers. And to recognize that, one of the things we need to be clear about is that the community of the neighborhood needs more than our institution's product or services. So don't just tell a neighborhood what services you deliver. Talk about, because what they may need is your hours of counseling, and is not your hours of counseling, but what they need is the agency's copy machine or their meeting room or their staff's computer expertise. So ask the neighborhood what they need. Do not just tell them what services you offer. Also, when I work with an organization, I suggest adding 2 questions to the 3 questions I talked about earlier, which is what can residents do by themselves for themselves? What can they do with a little help from institutions? And what do residents need done that they can't do themselves, that only institutions can do? And the 4th question is, let's look at everything we're currently doing. Let's look at our list of activities that the agency is doing. And what can we stop doing to create space for citizen and resident action? I'm sure that every agency is doing something that people could actually do themselves, and agencies can actually stop doing those things. And then the 5th question is, what can we do to offer to the community beyond our services to help support that resident action? So we can't just stop doing those things. We have to prime the pump and begin to help build community by helping the community do asset mapping or connect with people so they can start doing those things that they can do themselves. So an agency can use these 5 questions and look at their current activities that they're doing to begin to identify places where they can stop doing things and partner with the community to do them, to pass the baton, if you will, in the relay race. The other thing that this does, this actually in many instances will free up the resources, the money that an agency has, so they're only investing their money in those things that only they can do, things that neighborhoods and residents can't do for themselves. So let me jump on now, and then we'll leave some good time for questions to talk a little bit about results-based accountability now and performance accountability for programs, activities, and strategies. How do we collect and utilize effectively the data and information necessary to make the mid-course adjustments for continuous improvement? And that answers 3 questions of how much did we do, how well did we do it, and is anyone better off? And so I found as a funder for many years using results-based accountability that I could just sit down with an agency or an organization and use this one graphic, and they would be able to begin to develop processes to collect the information they need to make the mid-course corrections. So if we have this kind of matrix of quantity and quality, effort and effect, the upper left-hand quadrant answers the question, how much did we do? Number of customers served, number of activities provided, and that answers the questions about how productive we are. Again, doesn't tell us anything about the impact of what we're doing, but it's very important. We need to know that for budgeting, for planning purposes. We need to know that for our goals. So if we so that we know, are we planning to serve 20 families or 200 families? You need 20 staff or 5 staff. So you need that. Do we need 3 locations or 1 location? So we need that information for planning. Also quality, which is about quality and effort. The upper right-hand quadrant focuses on how well did we do it, and are we doing things right? So there we're focusing on customer satisfaction. So we're asking people, how well did we treat you appropriately, and did we give you anything of value? We clearly need to focus on customer satisfaction. We need to focus on did we follow our protocols? Do we have the right staff in place? Do we have the right staffing ratios? Do we have the right certification of staff? But I think the most important one in quality is looking at our retention rates, because it doesn't matter how good our program is. If it's a 10-week program and most people only show up for 3 or 4 sessions, that tells us that whatever we're doing is not going to have the impact that is necessary. It also, more importantly, gives us really important information so that we can, in fact, change and improve our program. So if we notice that 60% of the people that we enroll in the program do not attend all 10 sessions, that tells us that we haven't identified all the barriers that we need to identify, and we haven't engaged all the partners that are necessary to make sure people can stay in our program long enough to get the benefit of our program. Also, if retention rates are on the other side of that coin, if people are staying in the program too long, we need to know that information so we can help identify what do we need them to do to help them to move on to the next level. But the most important questions are the ones below, which is anyone better off? And that relates to changes in skills, knowledge, attitude, opinion, behavior, condition, or circumstance. Everything we do should be related to one or more of those activities, and those are all measurable. Those are all measurable in the work we do. So changing skills, knowledge, again, we can do pre-tests, post-tests, we can observe, whatever that may be. So everything we do, we should identify ways that we can measure, is anyone better off, to tell us, are we doing the right things? And on the left-hand quadrant, we're measuring just the number of people, so the number of new skills, the number of people that learn new behaviors, the number of people that change their conditions. They were homeless, now they weren't, they were unemployed, now they are. But percentages are important, and that's the most important quadrant because that really gets a sense of how well we're sort of penetrating and really doing the right things. So if we find out, for example, that 40% of our clients are doing better, that tells us a couple things. One, we can look at that information and talk about the story behind the curve. Why are only 40% of our clients doing better? And we may identify that, well, we're dealing with a tough population, so 40% is actually a good number. So what do we need to do to improve it a little bit, but make sure we don't slide back, if you will? If we find that 80% of our clients are doing better, that tells us we're probably doing it fairly well, so we want to make sure we codify those protocols that we're following, but still collect information so that we can make the mid-course corrections to make sure that our program works for everybody. Particularly, this is where it's important to disaggregate the data relative to racial and ethnicity, so that we make sure that the services we deliver are having a similar or positive impact for people of color as well as not in the work we do. But having this information of the numbers and the percent of people and the impact we're having, the number that are changing these conditions, really gives us the information we need to make the fine-tuning requirements and changes that we need to be effective. So again, I've found that agencies, when we give them this graphic, and so that they can begin to fill it in with not only their actual results, but their goals, it can become a very effective tool. And the other way, that coupled with these 7 questions that can be used for agencies and programs. And the 7 questions for agencies and programs start with, who are our customers? Again, what's our target population? How many are we projecting to serve? This answers the upper left-hand quadrant question. How can we measure if our customers are better off? This is where we address the lower right and lower left quadrant so that we begin to develop data and indicators that tell us how many clients are doing better, change conditions, attitude, etc. How can we measure if we're delivering services well? What are we doing to measure our quality, whether that's a customer satisfaction survey, whether we're looking at our quality of our staff, etc., and looking at the retention rate. And then how are we doing on the most important of these measures? That's where we graph all of these measures. We look at them and look at the history and the forecast of doing nothing if we don't do anything, and then we can begin to talk about the story behind the curve on all of these. Why are people not staying in the program long enough? What do we need to do to get people to stay in the program long enough? We said we were going to recruit 200 kids into our program. We've only recruited 100. What do we need to do to recruit more kids into the program? Who are our partners that we need to connect with to do that? So once we begin to look at those story behind the curve, we can then go to the next step, which is, who are our partners that have a role to play? Who do we need to partner with so we can recruit more kids? Who do we need to partner with so we can remove all of the barriers so people can stay in our program longer and get better results? And so once we've talked about partners, then what works to do better, including no-cost and low-cost ideas, and the no-cost, low-cost ideas is where we bring in asset-based community development. No-cost is answers the question, what can people do by themselves for themselves? And the low-cost addresses the partnership, what do we need to do together with community to make a difference? So once we brainstormed a wide range of ideas and activities about what we could do to improve our individual programming, then what do we propose to do? Okay, over the next month, over the next 6 months, over the next quarter, what are we going to do to improve our program? What new partners are we going to reach out to, and what new activities are we going to start? So before I open it up to questions, I wanted to just talk a little bit about the linkage between population and performance. So we have, again, an example here, population accountability, youth succeeding in school. Third grade reading, and the indicators we're using to measure that success are third grade reading at grade level, middle school student proficient in math, and percent, and number of students dropping out of school. So those are our overarching community level, population level results and indicators. And then we have a sample here of one individual program, the Middle School Intensive Mentoring Project. And they have their individual goals and strategies and activities that they're measuring. And so they have a clear, so that's the customer result versus the population result. They are different. And the customer result or the agency result is a contributory relationship and not cause and effect. One of the things I think we did a disservice to is, and when we began outcome-based funding as a United Way professional, I began that in the early 80s, and we used to ask agencies, how can you prove that what you're doing is having an impact on the community, is having community level impact? And the fact is you cannot prove that cause and effect. There is a contributory relationship and not a cause and effect relationship, because it takes a whole host of activities, as I've talked about, to turn the curve at the community level. So we have a wide range of activities. Interagency collaborations are necessary, agencies working together more effectively. Again, the no-cost, low-cost ideas of place-based work we need to engage policy changes, and all of this activity together has the opportunity to really create that collective impact that's necessary and gives us a much better chance of turning the curve in our community and improving the lives for kids, families, and seniors in our community. So let me stop there and roll it out to our questions again.
Okay, is RBA something a group of community workers should use as a framework, or is it better suited for the funders of said community workers?
Personally, I think RBA, the concepts of RBA can be used by any group, whether an individual organization or a community group, because it focuses those 7 questions, and the principles of RBA can really help provide the framework that's necessary to help you move from ends to means and from talk to action. So I recommend that anybody can use RBA.
Okay, how does the ABCD process fit within the larger collective impact context?
Again, in collective impact, what we need to do to be effective is not just improve the service system, the human service system or the healthcare system or the programs or services, but we need to do policy change, we need to use the media, we need to change structures, but we also need to engage the community as part of the solution. I think everybody would agree that community impact is not just about the service system, but it's also about the community. And my experience has been asset-based community development can provide that framework and the principles to help a collective impact initiative effectively engage a community in this work. So the other thing I'll highlight is that, so I would highlight that collective impact is significant but not sufficient to make change, and ABCD is necessary but not sufficient to create change. It takes both working together, both the human professional system and the community working together under a collective impact umbrella. Then I think we have a much greater chance of achieving success.
Can an organization use the performance measure matrix to set numbers or percentage goals and use information collection to rate results against goals? Yes,
absolutely. At the performance level, where an agency is setting those goals of serving 200 people, 80% success rate, 80% learning new skills, whatever that is, we do recommend that organizations set goals and objectives around that, and that they track that data real time, not waiting to the end of a year, but really at least monthly or quarterly, looking at that data so that they can make the mid-course corrections when they find something that's not working, or if they find something that's working well, they want to make sure they're employing it in other parts of their organization.
Okay, how do busy residents effectively play the role of producer given the need for a sustained effort that may not be feasible?
Again, that's one of the reasons I recommend place-based strategies and focusing on the gifts that people have, particularly their gifts of the heart, their passion, because our experience is that even very, very busy people can find a bit of time in their life to do something around their passion, whether that's caring for kids, whatever that may be, if we can remove barriers, and one of the major barriers is make it easy. And limit, and sort of, if they just have to go down the 2 doors down or a couple streets down or do something on the weekend with a couple kids in a community, people for the most part will find time, but we have to be continually adding and connecting more people because people's lives change and they will get busy, they may get sick for a while or something, so they'll be stepping back. And so that's why we want to connect more and more people in a neighborhood to become part of the solution so they can rely on each other as well.
Can you comment on the tensions between inward-looking bonding social capital versus outward-looking bridging social capital as they relate to ABCD?
So again, at the level of ABCD, we're really, again, using it at a place-based connection. So our major focus of social capital is about people knowing their neighbors and connecting with their neighbors, and then also connecting with their association life. So within an association, so if we have, whether that's a church or the men's softball league or the reading club, everybody knowing each other and then talking about where there's commonality of passion, motivating some action to do something about that passion. So it's a connection of both knowing each other and connecting around their like passion to do things collectively.
How does the principles of the Ottawa Charter relate to RBA and ABCD?
Of the what, I'm sorry?
Ottawa Charter.
I'm sorry, I'm not familiar with that.
Okay. That's all the questions we have.
Okay. Well, let me just kind of closing remind everyone that if they would like a copy of the recording of the webinar as well as any of the materials, you can respond to the survey that we're going to receive. If you have any questions or follow-up questions, please feel free to contact me at my email there below, dan@resultsleadership.org. Also wanted to let you know if you'd like more information about results-based accountability, please feel free to order both Mark Friedman's book, Trying Hard is Not Good Enough, and Turning Curves. You can also visit a variety of websites that you'll see on the PowerPoint that you can use, and if you'd like to find out more information about asset-based community development, you can visit the ABCD Institute's website, ABCD in Action, which is an online community with about 1,500 people from around the world that are connected to ABCD, so you can connect there and answer questions. Also, John McKnight and Peter Block wrote a book a couple of years ago called The Abundant Community, and you can log on to their website and learn and download a variety of resources about ABCD as well. Also wanted to remind you that this is one of a number of webinars that we'll be doing during 2016. So you can visit the resultsleadership.org's events website to learn more about our free webinars and our webinar series, as well as a number of training workshops that we're going to be holding. And we're also holding 2 conferences this year. And the first one is in Baltimore, Maryland on June 1st or 3rd, or 1st through the 3rd. It's a 2-day conference with pre-conference workshops. I'm actually going to be doing a all-day RBA and ABCD workshop as a pre-conference at the conference, but you'll be able to join leading community change experts exploring the concepts of results-based accountability during the Baltimore conference. So please check that out on the resultsleadership.org website. So with that, I want to thank everyone for participating, and it looks like we have a few more seconds. Are there any other questions, Eileen? Nope, no more questions. So again, I want to thank everyone for joining us today and have a great rest of your day and rest of your week. Thank you very much.